Hi, I'm Dr. Chris Ho. I'm a skin cancer physician based in Brisbane, Australia. And today we are talking about stage 3 melanoma, what it means, how it's diagnosed, and what happens next. If you've heard the words stage 3, it is completely normal to feel alarmed. So let's slow it down and go through this step by step, calmly, clearly, and honestly. How do we get a stage 3 diagnosis? It all starts with a biopsy, usually taken from a suspicious mole or skin lesion. The pathology report gives us two important numbers: the Breslow thickness, how many millimeters deep the melanoma has grown, and the Clark level, which layer of the skin it has reached. These describe how deep the melanoma has gone into the skin, but they don't tell us whether it has spread. To assess that, we need to determine the stage. When is staging done, and why does thickness matter? Here's something I really want to emphasize. Staging is not based on the level. It's the thickness that guides whether we need to do further testing. If the melanoma is less than 1 millimeter thick and shows no high-risk features like ulceration or rapid cell growth, then no further staging is usually needed. But if it's 1 millimeter or more, or has signs of being aggressive, then your doctor may recommend a sentinel lymph node biopsy. That's a procedure to check whether melanoma cells have reached the nearby lymph nodes. If melanoma is found there, even in a small amount, that's when we diagnose stage 3 melanoma. Is this the same as level 3? No, no. And this is a really common misunderstanding. Level 3 just means the melanoma has reached the upper part of the dermis, still inside the skin. Stage 3 means the melanoma has spread beyond the skin to the lymph nodes. They're not the same, and they're not even linked. I explained this more fully in my other videos. Level 3 is not stage 3, and level 2 is not stage 2. You can see and watch these videos through the link that I'll put at the end. If you're unsure what the difference between level and stage, that episode will really help. So, what happens after stage 3 is diagnosed? If a sentinel node biopsy confirms melanoma in the lymph nodes, you will usually have scans to check for any further spread, blood tests, and referral to a specialist melanoma team, surgeons, oncologists, and nurses who will work together on your care. How is stage 3 melanoma treated? Treatment usually includes surgery to remove the affected lymph node groups, immunotherapy to help your immune system attack any remaining melanoma cells and reduce the chance of recurrence. The treatment plan is tailored to you, and you'll be supported throughout. Am I going to die from stage 3 melanoma? Let me answer the question so many people are thinking, even if they are too afraid to ask. No, not necessarily. Stage 3 melanoma is serious, but very treatable. Thanks to immunotherapy, many people today are living long, healthy lives after treatment. So while it's not something to take lightly, it's not a death sentence. Talk to your treatment team. Every case of melanoma is different. So even though we have talked about the general approach to stage 3, Your specific treatment plan might vary based on things like the exact thickness and the location of the tumor, how many lymph nodes are involved, your overall health and preferences. That's why it's so important to speak with your own treatment team, your skin doctors, dermatologist, surgeon, oncologist, and melanoma nurse. They'll help guide you through the options that are right for your situation. You don't have to face this alone. Support and help in Australia is available. In Australia, we have strong support networks. Melanoma Patients Australia with peer support, helplines, and patient stories. Melanoma Institute Australia with up-to-date resources and education. Cancer Council offering counseling, support lines, and transport assistance. Talking to others can make a real difference even if you just listen at first. There's strength in knowing you are not alone. In summary, stage 3 means melanoma has reached the lymph nodes. Staging is based on spread and triggered by thickness, not level. If the melanoma is under 1 millimeter and low risk, staging is usually not needed. Level 3 is not stage 3. Treatment usually involves surgery and immunotherapy, and many people with stage 3 go on to live long, healthy lives. If this podcast helped you feel more informed and immunotherapy, staging is usually not needed. Level 3 is not stage 3. Treatment usually involves surgery and immunotherapy, and many people with stage 3 go on to live long, healthy lives. If this podcast helped you feel more informed and more hopeful, please give it a like, subscribe, or share it with someone going through something similar. And if you haven't seen my other videos on melanoma levels and staging, you'll find them here, and also in the description below. Take care of your skin, and I'll see you in the next episode. This podcast is for general information only. It's not medical advice. Please consult your own doctor for personalized care.